World Financial Group offers entrepreneurs from all backgrounds the opportunity to start their own business on a level playing field. Dr. Jana Woodhouse, receiving the WCM Wall Street Pioneer Award by the United Black Wall Street of America, Inc., is one of those entrepreneurs.
I see WFG and TFA as a place where African Americans with an entrepreneurial mindset can flourish. And the bonus, we help families and serve the communities across the country.
To learn more about us, go to worldfinancialgroup.com.
We are the sons and daughters of the soul. We are resilient and forever forward-thinking. We ask for nothing else than the opportunity to live and to create the lives that we were meant to live. We want nothing but an equal chance at options and possibilities. The same possibilities and options to live out our potential as our fellow man. We want to be heard, understood, and expressive in our reality. We are the future. We are the creative. We are here.
She was told that she couldn't play with the boys. She was told that they were too big, too rough, too strong. She was told to give up her dreams and move on. She was told to just be pretty, be quiet, be a lady. She was told that women had to stay on their side of the court, stay in your lane. Playing and competing with men was insane. She was told that men and women would never be equal. Dreaming like that would only be legal to your mind, to your soul. She never listened. She knew that their thinking was old. She is magic. She is the definition of spirit. She is what champions are made of. She is now.
Greetings and welcome to Access Wealth Nation with Dr. Jana B. Woodhouse, me. So you can have that checkup from the neck up and be able to do different, be different, and make a difference in your life. As you know, my philosophy is if you know better, you will do better. It's just important to have that knowledge out there. And unfortunately, in our world, we have not always been taught about financial literacy. So as you know, we have our book, How Money Works, Stop Being a Sucker. And if you'd like that book, you have to go to our website, or better yet, give a call to 646-375-2121, which is my office, because some of y'all are requesting this book and you're not giving us the address. It is a live physical book. And so therefore for you to get it, again, there's so many ways of which you can get the books that we have, the information we have. I have a website that just caters to financial literacy. It is wealthwave.com/Jana B. Woodhouse. No, just Jana B. We cut the Woodhouse. You know why? Because the name is too long. But anyway, it's yes, wealthwave.com/Jana B. That's Jana with the J. Okay, and we are being broadcast on the Soul City Network, and of course on WHCR 90.3 FM, the voice of Harlem. And so today I'm not taking a lot of time chit-chatting and talking with you guys. Y'all know the scope of what we need. If you want a free financial analysis, we'll be glad to provide it. You just have to give the office a call, and one of my associates would be glad to work with you. And some of you have really joined on board, and I'm very happy. I think we've made some differences. Of course, you can always reach me at Anaj Enterprises Inc. at gmail.com. That's ANAJ Enterprises Inc. at gmail.com. The reason why I spell everything, because WHCR also happens to be just a radio show, and we don't want anybody left out. That being said, I have one announcement that has to be every time I come on until January 1st, and that is the BOI .gov. BOI, no, it's FinCEN.gov is how you go to it. FINCEN.gov. You must, if you have an LLC, an S Corp, a C Corp, well, sometimes on a C Corp, you might be exempt. But if by January 1st you have not done the business owner's information regulation, you will be charged $500 per day as a fine. So it is imperative that you get in touch with your accountants. There are vehicles out here that will fill the form out for you. I'm going to tell you straight up, you can do it yourself, and it doesn't cost you anything to do. It is to identify who are the business owners, those who have an interest in the business, at least 25%, could be less, but 25% of the business, and you must identify yourself with your ID, which would be your state ID, preferably your passport. This is to make sure that you're not doing anything on a terrorist site. And you're not, but if you don't do it and you're not actively working your business, then therefore you might want to think and consider closing it so that you won't have to deal with this. But if you're going to keep the business active, then you fill the form out. You only do it once unless you change owners or information. At that point, you have to amend it and you go to the same site. So that's my little mark that I think everybody needs to know, because for some reason, people aren't talking about it, or they are talking and charging $450 to $1,200 to fill the 15-minute form out. I'm about really just trying to make sure people are within compliance on that. Okay. That being said, we were talking about Medicare 101 basics. As I've become an associate within the Medicare field, I have learned a lot. Number one, I learned specifically that when you turn 65, your world can change. And we're going to discuss some of the basic things that you need to know. Those of you who are out here, some of the things that you just need to know so that you can make an educated decision. So you know what I do, I go and get the expert. And the person who is mentoring me and has spent years in the Medicare field, in the HR field, understanding she has brought onto her business, which is Insure with Grace. I think I love it. I know I love it. I love saying it. I love being a part of her organization also. She's a great mentor and teacher. She also has brought financial literacy into her business and vice versa, and has become very, very successful. And now she's become a good, I always say there's a brother from another mother. Well, this is a sister from another mister. Okay. But we have really bonded, and she has assisted me in helping people do the right thing with their Medicare. And she is a Medicare specialist. She's phenomenal. If you have questions, you can put them in the chat. If it's after the show has gone off, you can send me the emails and I will be glad to address it. Good evening, Debbie. Good to see you here. I'm glad you're here. Get your questions answered. Okay. And so with no further ado, I'd like to bring on Grace Himmelright.
Hi, Jana. Thank you so much.
Thank you.
I am very excited to be here. Very excited. I enjoy the show so much, and I share it with people. It is just such a resource, and I'm excited for us working together in the Medicare arena like we do in financial literacy.
Yes.
And, next year I'll be a grown-up in Medicare because I'll be at 21 years.
Wow.
So this year it's 20, but I'm happy to help anyone.
That is awesome. And your knowledge is astronomical. It is phenomenal. You have helped some of my clients as I'm getting through my lessons. You know, people know I've been in this industry for 40 plus years, but Medicare was not an area. And I was like, okay, let me do the Vanna and pass it on. But Grace really showed me where this could be done and be added to my practice. And
Yeah.
I just am glad that I have this relationship. So we're going to dig deep right now into some of the things that I think people would like to know. And one of the things, okay, there's this whole thing, October the 15th to December the 7th. I had one of our mutual clients come back and tell me, he said, you know, December 7th is important. And I said, do you know why? And he said, no, it's just on the ads. So now we're seeing all of the ads that those of us who have turned 65 or those that are turning 65 have gotten an astronomical amount of mail. So what's the significance of this October the 15th to December the 7th?
Sure. Well, when you're already on Medicare insurance, so you've enrolled in Medicare and you're covered primarily using that insurance, this is your window. Just like when you were working and you had a window when you could change your insurance or your HSA contributions, October 15th to December 7th is when someone that is already on Medicare can make changes to their insurance, which then is effective January 1. So this is known as annual enrollment.
Okay, so this is their window. But are there other dates that someone who, and I found out, y'all don't know it, but if you're doing Medicare, you are considered a beneficiary. Okay, you are benefiting from this service. So is there other dates that people who are beneficiaries can change?
Yes. So if someone is in an Advantage plan, and we'll probably talk about that if you'd like in a little
Yes.
bit, but if someone is enrolled in an Advantage plan, the second time they can make a change is January 1st to March 31st. That's called open enrollment,
Okay.
OEP. I sometimes refer to it as the oops enrollment period.
Okay.
Meaning maybe you didn't make the change that you wanted to. Life could have gotten busy. But if you're on an Advantage plan, you get a one-time change January 1st to March 31st.
Okay.
And all Medicare insurance starts on the first day of the month. So if you make that selection to exercise your right to change during oops enrollment period, January 1st to March 31st, it becomes effective on the first day of the following month. So now we're at April 1st. No fooling. Okay. We made our selection and here it is, April 1st. There's some other election periods where people can make changes. One of those is personal, just to them. And that is if they move. If they move into a different county out of their planned service area, because Medicare divides the service plans by county. So if you move to a different county, that could create your own special enrollment period. Okay.
Mm-hmm.
Or if you develop or you have a chronic disease,
Yes.
such as diabetes or cardiac problem, every month, if you're not currently in a disease special program of an Advantage plan, every month you have that opportunity to find a plan that maybe really suits your health conditions. And as long as you're not already in a plan for that health condition, then you can select that. Also, if you are receiving, say, prescription coverage because you've served our country and you're VA connected, as part of the country's thanks to you for serving in the military, and you have VA benefits and you're registered with the veterans for those health benefits,
Yes.
then you can change to a special plan that is called a Medicare Advantage only, because you're going to get your Part D, your prescriptions, through the VA because of your service connectedness.
Mm-hmm.
So that is the special enrollment period that could happen for somebody in that scenario. Okay. And then the final scenario that's personal, right? Personal to an individual is if an individual becomes newly eligible for help from the state through the Medicaid program.
Okay.
The Medicaid program has different names in different states, but predominantly it's a medical program that is for people that are financially fragile, that if they get help from the state would pay, for example, their Medicare premium. It would pay some of their medical bills.
Mm-hmm.
So if you're new to that program, you apply and you become newly eligible, then that's a special enrollment period. So those aren't date specific, Jana. They're special to an individual. In fact, we call them special enrollment periods.
Got it. Yeah, those are people who situations, life occurrence.
Right.
And that's important. And sometimes you just need to ask if it, especially what has happened here in New York, there are so many things. Like, for example, I know I referred to someone who was receiving benefits because of 9/11 and wasn't sure what to sign up for, because they do get, they get a medical, not necessarily the best because it's good medical coverage. But the thing is that it's once a year. I think sometimes you need to have a medical more than, a physical more than once a year,
I agree.
Yeah, so that's it. Now, you mentioned something that was really the advantage versus the medical supplement plans. So can you tell us the difference? Because what they do on television, I know here in New York, is everything is, did you get the Advantage program? And it's like, okay, but no one's saying, well, how do I qualify? What is it?
Absolutely. So there is 4 areas that original Medicare doesn't cover. There's the Part A, which covers when you're admitted to the hospital. That's easy way to remember Part A, admitted. There's a deductible, though, with Part A. So that is about $1,700. And what's unique about the Part A deductible when you're admitted to the hospital, it can happen every 60 days. So that could mean 6 times. Now, that doesn't happen often, right? But that's the reality. So that's the first area that original Medicare doesn't cover entirely. And that's the Part A deductible.
Okay.
Then there's medical coverage as part of Medicare when you're not in the hospital, obviously. That is covered under Part B, like boy, okay? So if you go to a doctor's appointment, if you have outpatient surgery, any medical intervention and you're not admitted, that's covered under Medicare Part B. Mm-hmm. There's even some medicines that are covered under Medicare Part B, just a few. So Medicare Part B also has a deductible, right? Deductible. We have to pay before the insurance pays. So the Medicare Part B deductible is once a calendar year, and it's about $240. After you pay that deductible, Medicare will pay, but it will only pay 80%. So we have our Medicare Part A deductible, our Medicare Part B deductible, and the 20% that original Medicare won't pay of any covered service, doctor's appointments, x-rays, CAT scans, lab work, right?
Mm-hmm.
So all of those areas, people look to get insurance. Now there's one other very important area, because there's 4 areas original Medicare doesn't cover, and that's prescriptions.
Yes.
I mentioned that some are covered under Part B. Those are like injectable, biologics, cancer drugs, but there is a few. But your everyday medications that help us stay healthy, like blood pressure medication, or for some people, if their thyroid doesn't work great, a thyroid medication, those prescriptions are not covered under original Medicare. And they require us to have prescription insurance, which is known as Part D, like drug. And you get that from a insurance company. So the 4 areas that aren't covered by original Medicare, the Part A deductible, the Part B deductible, the 20% of Part B, and the Part D prescription insurance, that's what people seek to get coverage in. Now, as I mentioned earlier, if you're a veteran, you can get prescription coverage through the VA, but turning on your Part B is a very important consideration. And the Veterans Administration recommends that you do turn on your Part B. So you still, for the most part, even if you're a veteran covered at the VA, if you're eligible for Medicare, you want to turn it on. So how do we pay what Medicare doesn't pay, those 4 areas? You have 2 choices. You can get a supplement plan, and that will cover you can get it to cover all of your Part A deductible. You can get a supplement plan to cover all of the 20%, leaving you only with the Part B deductible. But you still have to get a Part D as in drug plan. So a supplement plan is partnered with prescription insurance, whether it's through the VA, as we mentioned, or an insurance company, and you purchase a policy. Okay. Those Good RX cards and the discount cards at the pharmacies, that is not prescription insurance.
That's good to know, because they sort of tell you that this is something you can use for your medicines and it'll reduce them down. But that's not an insurance.
No, it's not. It's a discount program. And you can have that and use it with your Part D prescription insurance. If it saves you money, you're not prevented from doing that. Okay. But it's not creditable insurance for Part D. So that's one way to do it. That's the supplement plan. So with that, you're going to pay premium for your Med Sup. Those always have a letter. Okay. They have a letter. The most comprehensive is Plan G. Well, Plan G like Grace. Right? So Plan G will cover all of your Part A deductible, will cover your Part B, the 20% that stays on your shoulders, but it won't cover the Part B annual calendar year deductible. Okay. And then, of course, you pay your premium for that. And then you pay your premium for your prescription insurance. Now, an Advantage plan combines your Part A, your Part B, your Part D, like drug coverage, into one card. It's very similar to people's insurance when they say had a job, right? And the Medicare Advantage plan becomes then your primary payer of your medical cost. So that's the only card you show. You keep your red, white, and blue Medicare card at home.
If that's your primary, so therefore you're paying a premium for that coverage that, like you said, it looks like what we had when we worked a job. And then now you have the Medicare card that's white and blue that I cried for the floor when I got it. I was like, I'm old, but it's a good card.
It's some good insurance.
It's a good insurance. So then that's what comes up first is what you are paying your premium. You're paying that premium for that.
So when you use a Medicare Advantage card, the government still collects your Part B premium from you,
Okay.
however you pay it, whether it's through your Social Security check, whether you write them a check or they take it out of your bank account. And then the government takes your Part B money and they pay it to the insurance company. And then sometimes you have an additional premium on top of that.
Mhm.
So the premium for the Medicare Advantage comes first really from you, because you must be active in both A and B of Medicare and live in that plan service area to get the Advantage plan.
Okay, for clarification, so you have someone who's getting ready to turn, because this doesn't happen until you start to turn when you turn 65, like going to turn 65.
Unless you're on a disability. Some
Oh.
people under the age of 65 with certain disabilities do have Medicare and they qualify for an Advantage plan. In New York, they do not have supplement plans that they can purchase. They can only have the Advantage plan process to cover what original Medicare doesn't cover, those 4 areas. Okay.
So someone who's turning 65, let's say they're turning December. I'm going to use, because that's the only next month we got. So they're turning this December. They're going December the 5th. They're going to turn 65.
Okay.
What is it that they are supposed to be doing? Because
well, they first become eligible for Medicare on the first day of the month. In the month they turn 65. So in your example, your person's birthday December 5th,
yes,
they could be eligible December 1st to have Medicare and to select which way they want to go, with an Advantage plan or with the Medicare supplement plan. All right. So what I advise people to do is there's a window, a 7-month window when you can turn on your Medicare. For most people, like I know I will be in just a couple years, I'm just a couple years behind you. I'll be very excited to have Medicare. And I am going to make sure I can have it the first month. So the first you actually are eligible is your birth month. And on the first day of the month, regardless of when your birthday is, the 7-month window that I mentioned relates to the fact that you can go to turn on your Medicare through Social Security.
Mm-hmm.
So you turn on your Medicare through the Social Security office, and you can request it 3 months prior. So your friend that you mentioned, our example of December 5th,
yes.
Okay, 3 months before that would be September.
Yes.
So in September, October, or November, they could say, hello, start me December 1. Yay. All right. That person could also have the opportunity, if it was in their best interest, to wait until January to turn on their Medicare to start. Okay. February or March.
Mm-hmm.
But after March 1st, right, requesting it past that window, if they went past April to get their Medicare,
yeah,
they're then late. And that is not a good place to be. Now, but let's just pause
I'm going to interrupt you just quickly.
Please.
So the 3 months that was prior to them turning, but it's plus the 4 months after. Is that
the month they could? So the 7-month window to request it starts 3 months before you're 65, the month you turn 65, or 3 months after. That's the 7 months.
Mm-hmm.
Now, some people are still working, right, Jana?
Yes.
Many of our clients, they opt to, or they feel the need to continue working past 65.
Yes.
If their employer has more than 25 employees and their employer offers them insurance that they're comfortable with,
Yes.
and every employer plan I've ever looked at in 20 years is as good as Medicare. Okay. Some may cost more, some may have deductibles. It might be that it's better for them to go on Medicare, but Medicare will allow us to just keep our employer plan until such time we separate from employment. At that time, we then need to turn on our Medicare.
Oh.
Because if we miss our opportunity and we're late, then there is a penalty. And the penalty is forever. The penalty is 10%. So the average cost of Medicare next year is going to be $185. 10% of that is $1,850.
Correct.
If somebody is late turning on their Medicare, they have to wait till the following January. And that's the special time when someone has missed their enrollments once, twice, 3 times, 10 years, God forbid. And then they're going to pay 10% more for each year missed for their standard premium forever.
Forever. They can never correct that.
No. Only if, God forbid, they qualify for Medicaid and become financially fragile. Never a goal. Certainly not for our clients.
Of course not.
Not that we don't help people that are financially fragile. We certainly do.
Sure.
So those are the rules when it comes to starting.
If somebody is still working and they want their jobs plan, they have their jobs plan, and they have turned 70 years old and they still working. 5 years later, they're still working. The reason why I asked this was because I remember there was Channel 7, Nina Panea, and she mentioned she had to get this woman out because she wound up, they gave her a bill. And this bill was because she earned over $100,000+ a year. And she had to pay this extra money, but she didn't know. Again, that's why I have you here, because people need to know, when do I turn it on? 65. If I don't want it at age 65, I still...
Because you have other coverage.
Right. Because I have, that's a good key. I have other coverage. I can wait.
Yes.
But how long can I wait?
As long as you have coverage that is credible meaning as good as Medicare, you don't have to turn on Medicare. Okay. And for some folks, I have clients that are in the medical field, physicians.
Yes.
And they have insurance through hospital programs. They have insurance for their staff through, group coverage. And they're planning to continue to work. Okay. We need to talk about income related monthly adjustment amounts. Now, the government quite often abbreviates things, and then they make it sound like it's a word. People think these abbreviations are words, but it's really an abbreviation. So the abbreviation that most often is talked about is called IRMA.
Yes.
Now, IRMA is not your best friend. Okay. If you have a best friend, IRMA, then she is not income related Medicare monthly adjustment amount, because that means it's going to cost you more.
Yes. So
in 2024, a married couple making $206,000 MAGI, modified adjusted gross income, pays the standard rate for Medicare. If they go over that, so 207,000 is their MAGI, that's when IRMA starts. And their Part B premium is no longer the standard rate. They pay additional for it, about $80. And there are 4 levels of IRMA. So it can go in upwards of $900 a month. So we know No, that would be their monthly Part B premium.
That's their Part B.
Right.
But if they
Right.
have to have Part D, they're going to pay.
It's also IRMA adjusted. Correct.
Mm.
Now, one of the important things about this IRMA adjustment is that it doesn't go away when your income goes down, like if you retire, or in the case of a physician, sell your practice. Okay. It doesn't go down unless you apply for it to go down. And when you apply for it to go down, because let's say perhaps you didn't apply and you're late doing it, and you have a tremendous CPA like, the famous Jana B. Woodhouse, who helps you and says, oh, we need to fix this. Well, even Jana B. Woodhouse can't make it go back with a refund more than 6 months.
Okay.
Okay. Tragically, I served a client that he and his wife, he sold his dental practice. And when he sold his dental practice, it brought in a very significant amount of taxable income. And that was 6 years before we met. And he should not have paid. He and his wife both were subject to IRMA for 5 years.
Mm-hmm.
And it was thousands and thousands of dollars. And I could only get him 6 months back because that's all the government will do.
At least he got something. Sometimes you get, again, nothing. And if you could pay it, great. If you can get yourself out of it, because your income dropped.
You have to file the form, though.
Yes.
Okay? It's very, very important. It doesn't count to just file your taxes.
Right.
The government doesn't correlate.
They don't work together. You have to go on the Social Security site and get that form. And it's best to talk to a professional who knows, that how you qualify, because that's so important. So
it is.
How much does it really cost to have? I know you mentioned Medicare. You got the 240, you got the 20%. How much does these Advantage plans?
Okay.
Are they really a savings for you?
Almost definitely. Almost definitely. And the majority of them include dental, both comprehensive and prevention. They include vision coverage, which original Medicare does not include either dental or vision.
Right.
Okay. Now, if you need to have cataract surgery, that's medical. So then that would be covered, even though it's a treatment of our eyes. Mm-hmm. The very, very much sought after plans include hearing aid benefits. Again, not covered by original Medicare. And so with original Medicare and a supplement plan, you're going to only get coverage that is attached to original Medicare. Because the supplement plan, also sometimes called Medigap, it only fills in the gap of what original Medicare Part A and Part B do not cover. So the Advantage plans are more focused on wellness. And you get healthy benefits with these Advantage plans. Some even go so far as to give free over-the-counter health products. Mm-hmm. Some include grocery benefits. The Advantage plans are network-based, though. So it's very important that you work with a professional that looks up your team of physicians and make sure that the Advantage plan is a good fit for you, right? We do that so much in our business day, don't we, Jana?
Oh, definitely.
Whether we're advising about tax savings or wealth building. It's the same in the realm of Medicare.
And so the thing is that suppose people can't find their doctor in a plan. What's their options? Do they?
Well, we live in America. There's a lot of doctors to choose from. Okay. And I always tell my clients, before you make all of your decisions based on that human being, okay? I mean, think about it. Doctors move, they retire, they pass on, right? They're not immortals.
That's true.
And so it needs to be a very important component of our decision, but perhaps it's not the one and only component, right? Finding a specific doctor. Now, of course, that individual could select a supplement plan, because if they stay with original Medicare as their primary payer and they have a supplement plan, there's no network. There's also no dental, there's no vision. So they might have to purchase those plans. There's no hearing aid insurance other than an Advantage plan. You can't buy hearing insurance.
Okay.
They don't get any of the wellness benefits that we talked about. And let's talk about cost.
Yes.
With a supplement plan, you're going to be looking at, on top of your Part B premium, a premium of over $100 by the time you pay for your Medigap, your supplement plan, and your Part D insurance. And then dental and vision insurance, if that's something that's important to you. As we age, for many people, that's important.
It's important. Dental is really, because, it's like my dentist said, it's really not dental insurance. It's just a little bit of a credit.
It is. It is.
It's costly.
Just takes a little bit of the bite out.
That's it. That's it. Definitely. So someone who's really looking at this, I guess I would ask it this way. I know the answer, but I want to hear it. Is that every every October 15th to December the 7th, it's just like how we do our physicals. We should look at our Medicare plan.
I agree. It's very important.
If it would work, is it still working? Because there are things that we might have changed. Got a cancer diagnosis, have diabetes, which, eventually everybody winds up with that sugar. I don't know. We get sweet, but all of those things you need to take into account. So even though you have a plan and you might have even an Advantage plan, but you need to see if that's still fit, or is there something that one of the providers is going to give you something extra.
Right. It really is an annual decision. And one of the ways that I also talk about supplement plans is every single year guaranteed your premium is going up. Every single year. And at some point, sometimes people get to a tipping point. I've had quite a number of clients this year that have been with me for a number of years since they retired, more than a dozen years. And their supplement plan, quite honestly, has become unaffordable with monthly premiums over $500 and their Part D plan on top of that. So we've looked at the Advantage plan, because one of the things that the Advantage plans have is a very low premium, but you pay co-payments as you use it. And every Advantage plan has a maximum out of pocket, a stop loss, where it can't cost more than that. And these clients that are paying before they see a doctor, right? Before they get any medication, are paying over $500 a month, are looking at these Advantage plans that may be the maximum out of pocket in their worst health year ever, that only 1% of the population statistically reaches the maximum out of pocket, is under what their premium is.
So they need to look.
It needs to be a possibility.
Yes,
it really does.
And that's why that window that's so important. And then also the window that you have, the personal window, take advantage of these things, because if you don't do it, and especially, I'll say it this way, I never thought about being an agent, but I understand. And what really does an agent make? How does an agent make a difference?
Well, one of the most important things to realize is that there's no cost to our services when it comes to consulting and advising, if we find a good fit, the insurance company pays us. The client doesn't have to. Now, certainly, United Healthcare and Humana, they would love it if you just call 1-800, right? Because then they don't have to pay us.
Yeah.
But realistically, then you never have an advocate. You only have an 800 number to call. And there are times when insurance companies make a mistake. And when I or you are the agent of record, we can advocate for our clients and we can help them navigate getting either the bill that was incorrect from the provider, the healthcare provider, reassessed, or the ruling by the insurance company about coverage reassessed and corrected, or an exception granted with our intervention.
And that's
So it doesn't cost anything more, right? And we are there as the expert to help.
I think that's so important. That's the same way as you all have heard me talk about having a financial advisor or a fiduciary that will take care of you, that will be concerned and not be concerned about their pocket. They're
Right.
going to get paid anyway. But the key is that these services are set. So has anything changed for 2025?
Well, as a matter of fact, there is some changes for 2025. So the companies, the providers, the insurance companies that offer grocery benefits, that offer help with paying for utilities, there's a new law that those types of benefits, they're referred to as, I'm going to get my cheat sheet here,
because
it's an acronym. It's an acronym.
You know how much I love those acronyms.
All right. It's known as these benefits that I described, the not the over-the-counter benefits where you get vitamins. That's regardless of your health. Right. The groceries and the utilities predominantly. Mm-hmm. Okay. Those are known as SSBCI, Special Supplemental Benefits for Chronically Ill. Mm. So Medicare defines us as chronically ill if we have a condition that requires ongoing maintenance, such as taking a statin or taking a blood pressure medication, or if we're diabetic. So next year, the companies that offer those benefits, which are very sought after, they're very helpful.
Sure.
They have to qualify the individual. So most of the companies are looking at qualifying based on your claims. So if you haven't been to the doctor, or if you don't take a statin or some kind of maintenance drug, your doctor is going to be contacted to ask, does your patient have a chronic condition that requires ongoing care for you to be able to receive that benefit? Now, I have no idea why the government cares if United Healthcare or Humana gives their members $50 for groceries or $150 a quarter for utilities or whatever the benefit is, but it's a new law. And it's a little cryptic because in our information from our healthcare insurance, it never says SSBCI. Okay. So that's a change. There's another change that is starting in January, and that has to do with prescription cost. So when we take medications that are covered under Medicare Part D, like drug, the government is capping our out-of-pocket at $2,000 for a Medicare beneficiary for formulary covered drugs. So if a drug is prescribed by our doctor, it's it's covered in our insurance, it's in that list of drugs known as the formulary, then the most we'll have to pay for that in a calendar year is $2,000.
Oh,
And every insurance company has to provide the opportunity for what's called smoothing. And that is to spread that out on a monthly payment,
okay.
right? So if we take $2,000 and we divide it by 12, that is how much beginning in the first of the year, it's about $167 we would pay a month. And all the individual, the Medicare beneficiary, as we're called, has to do is call that insurance company that's going to be in place in January, Jana, and request prescription smoothing. And they can go into that payment plan. So
Okay.
there's no more donut hole, no more coverage gap, and a new first time ever maximum out of pocket of $2,000 per calendar year.
Okay.
It's a huge reduction from 2024, where our maximum out of pocket for a Medicare beneficiary is $8,000.
Yeah, that's a big difference. And but see, that's where the agent comes into play to explain this, because we just know changes are taking place. It's just like what I do when tax changes take place, or investment strategies, like what we're getting ready to embark upon, some updates on investment strategies. All of these things are important to have a professional work with you.
Yes.
Understand, because who knew smoothing? Okay. But it's good to know, because this will cut the cost down. There are people who are, for example, who are receiving maybe public assistance,
Yes.
but they're changing because they got out. Now they
Yes.
have to be aware of what this change takes place and what they have to come out of.
Yes. Another very big change for those individuals, people who do receive public assistance or Medicaid,
Yes.
this calendar year, they were able to change their plan once per quarter in the first 3 quarters of the year.
Mm,
That's that special enrollment period.
right.
But next year, only new to Medicaid covered individuals can change their plan
Mm,
outside of that open enrollment period.
hmm
Okay. So the open enrollment period, that the Medicare covered individual receiving public assistance that's on Medicare, they have that same one-time election during January 1st to March 31st,
Yes.
the open enrollment period. Okay. After that, they don't have an opportunity to change their plan again.
Well, they can change when
During annual enrollment,
the annual enrollment
they have to
period.
wait till the following year. But what they've been accustomed to, and what has been the law for
Mhm.
quite a number of years, is that they can make a once per quarter change each of the first 3 quarters.
Yeah, that's gone.
Okay, that's gone in 2025. So they have to be very aware of this change and make sure that they maximize their benefits for the plan that's the best fit for them. Some of these plans include as many as 90 rides for a Medicaid covered individual.
Wow. Oh, we got a question. If you are 73, have Plan A, and is covered by your spouse who's retiring soon, do I now get the other plans? She needs
Yes,
to be reviewed.
you will need to get special proof of creditable coverage from your spouse's HR showing that you've had Part B medical coverage and prescription coverage during this time that you've had only Part A, so that you're not penalized. And then you will be eligible once you turn on your Medicare Part B, and you want to apply for that at least 30 days prior to needing your Part B to turn on at the Social Security office, or you can upload the documents from your husband's employer coverage through a portal on ssa.gov requesting Medicare Part B start. Okay. And that's something that, either Dr. Woodhouse or myself would be able to assist you with, because it's very important that you do that in a timely fashion so that your coverage is in place and you don't have a lapse.
Right before.
And also, and you don't want a penalty for late enrollment.
And that's important because a lot of spouses do have insurance with their spouse, and then the spouse retires.
Yes.
And some of these plans, like I know 1199, their program is for hospitals, and they cover the employee for life, not the spouse.
Not the spouse.
Not the
Right.
spouse.
Right. And if your employer has, fewer than 25 employees, they can require you to turn on Part A and Part B of Medicare to stay on their plan. And most retiree plans, like the 1199, they still have to turn on their Medicare.
Okay.
To be eligible for that retiree plan.
Got it. Definitely.
There's the only exception to that I've come across in my years of serving people has been with the original postal insurance for postal carriers. That's been phased out now, but there are still people that have that eligibility where they don't have to turn on their Medicare Part B like boy.
Yes.
And pay that premium. But, those folks are our seniors and they're aging, and eventually will go to glory. And even the postal FERS covered and postal worker covered, will be required to turn on their Part B.
That makes sense, because again, medical coverage is quite expensive. And, as soon as they can get you, you just make one mistake and it can be a costly one, just as simple as how I learned with the Cobra. And I thought all the time, I said, okay, well, somebody who can afford to do Cobra when they leave the job. But we also found out that does not cover the Part D.
Oh, yeah. Cobra is not considered creditable coverage. You will have a late enrollment.
And see, that can be
absolutely.
crucial to someone. And, it's like, in a sense, you're it's not knowing is no excuse for breaking that law,
Right.
There are things. And so I would say to you, the time went by. I'm going to have to come get you back. We'll do it after the enrollment coverage is closed, after December the 7th. But I think this was a lot of information that was good. And I'm hoping that everyone made note. If you have questions that we didn't get to, please send them to anagenterprisesinc@gmail.com. We will get them answered for you immediately, because December 7th is a very serious time. And so, I want you to really take this, and not just take it, but to share it. My philosophy is, you learned something today, you need to share it with whoever. Did you know? Send them. Thank you very much. Very good information. Give it to others. Have them come to Access Wealth Nation on YouTube, or also you could go to Facebook to Access Wealth Nation and have them listen to this program, because it replays. And you had a question, Debbie. It says, I was told I couldn't get anything until he retired. We will talk. Okay,
yes.
We'll talk.
Yes.
Okay, but in the planning phase. Okay, next time I want to share with a nursing home or senior center. We'll get my contacts ready. Okay, this is one of our associates at Wealth Wave. Important information. Yes, it is important. And we do want to, especially senior citizen homes, because I'm talking to senior citizens groups, because they do not know. And
Yes.
if we don't tell them, who will? Like you said, that 800 number is cute, but if they have extra questions, or I want to keep this doctor, but I don't care whether I lose this one, and those kind of things are important. And so how to contact. I am under the tutelage of Grace Himmelright, and I'm so proud to. Her 21 years is going to be my 21 years, because it is so important. I hope you learned something here today. This is so important. And again, please share it, because this, along with that BOI that I told you about, no one's talking about it, telling you what to do. And if you know better, you'll do better. If not, well, at least for Medicare, the penalty is not $500 a day, but still, it's your life. It can be something, as you learned today, it could be a penalty that stays with you forever till death do you part. And why give more when you don't have to? We got enough. So, Grace, is there any last word that you'd like to share with people? Anything that you'd like?
There's a lot of misinformation out there, Jana. So I'm so glad that we had this time together. People, well-intentioned people that are not professionals, that are not licensed, advising people. And one plan doesn't fit all. One strategy doesn't fit all. And you and I both love to customize. It's what we do.
Yes,
that's how we serve.
So I'm so thankful, Grace. Thank you again for being on Access Wealth Nation. We are so glad to have you. I'm going to have you back. Someone said, good evening. Okay, thanks for the great information. Okay, yes, Elsie. Yes, good. These are some of my wonderful clients that are chiming in. I'm thankful to them, and that we can help. We will. That's what we're here for, is to help. It makes a difference. So everyone, you have a good night. Thank you so much again, Grace, for being on.
My pleasure.
This is Dr. Jana B. Woodhouse signing off.
She was told that she couldn't play with the boys. She was told that they were too big, too rough, too strong. She was told to give up her dreams and move on. She was told to just be pretty, be quiet, be a lady. She was told that women had to stay on their side of the court, stay in your lane. Playing and competing with men was insane. She was told that men and women would never be equal. Dreaming like that would only be linked to your mind, to your soul. She never listened. She knew that their thinking was old. She is magic. She is the definition of spirit. She is what champions are made of. She is magic.